want to talk with you about Bell's palsy. Bell's palsy is when you have a sudden onset of drooping and muscle weakness on one half of your face. It is thought that it occurs due to a viral infection, so a virus that causes swelling and puts pressure on your seventh cranial nerve, so your facial nerve, which is responsible for the movement in your face. There are numerous studies in physical therapy, though, that suggest that dental work can cause Bell's palsy. Anytime you have your mouth open for so long, it can cause pressure and pinching on that facial nerve and then cause Bell's palsy. And I will tell you that I have had Bell's palsy, and it was due to the day before having dental work done. My mouth was open for about an hour and 45 minutes. I had my young daughter running around, so I forgot to make sure I took the rest to get the pressure off of my nerve. The next morning I woke up, I started seeing my eye droop, my nose droop, my mouth droop. I could not smile. I had one side of my mouth that would not lift. Your self-treatments at home would be eye drops to keep your eye moist. Also, facial massage, so any kind of massaging on that side of the face, helping to lift, to help prevent contractures, smiling, puckering up, squinting your eyes, closing your eyes, raising your eyebrows, any kind of functional movement, expression movement of your face would be a good self-treatment at home. Whenever I had it, I knew immediately that the Novocaine should have worn off and I could see the difference in my face happening. So I went back to my dentist and I discussed with him where steroids help. So to get that inflammation off of the nerve, your nerve, anywhere in the body, nerves are covered by what is called a myelin sheath. It is shaped like a bunch of sausages put together, and if one side gets pinched and that myelin, that nerve gets pinched and the myelin sloshes off, then it causes an electrical issue. So such as, I always explain it like my cat, Mountie, he used to chew our lines to our phone. He ruined about 14 phones for us. But when he would chew the phone wire, then the connection, sometimes the phone would work and sometimes it wouldn't. That's what happens with our nerves. But if it's very severe and that sloshes off, you have to redevelop that myelin, and that takes time. But vitamin B complex is extremely helpful in regenerating that myelin covering on your nerves. So that helps out tremendously. So I did vitamin B complex morning and night. In addition, I took the steroids in a pretty high dose, about 40 milligrams for about 6 days, and that took care of my issue. My Bell's palsy was gone within 1 week. I was extremely fortunate because Bell's palsy, unfortunately, normally takes about 6 months to resolve. Your nerves, if the nerve has completely been severed and damaged, there's no guarantee that that nerve will completely come back. In addition, your nerves only regenerate about 1 inch a month. So it takes a long time. Physical therapy can also be very beneficial in, again, preventing any muscle contractures, any drooping of the lip. You want to make sure that you continue to work those muscles. And we also have what's called an iontophoresis, which is where we can put a little patch onto the cheek and another patch so that we can drive some treatment in there, a steroid, just into the area that it needs it. Get treated immediately. you want to start that steroid within 48 hours, but also that massage to encourage the blood circulating into the area again, and that vitamin B complex. So hopefully this helps. Have a good day.